The absolute best thing about being here is taking care of the person across from me. My name is Javier Cardenas. I'm the director of the Neuroperformance Innovation Center. I'm a neurologist. I specialize in traumatic brain injury. I work with all sorts of patients who suffer concussion and other brain injuries. A traumatic brain injury occurs where there's a direct or indirect impact to the brain that causes a change in brain function. Recovery is different for every single person and every single brain. The great thing is, regardless of the severity of your traumatic brain injury, we can help. And that help involves a team of people.
Our main focus is to get our patients back into their everyday life, which could include work, school, or sports.
In all instances, it's been a traumatic event that we're seeing them for. And so after this traumatic event, they've altered the way that they've lived their lives basically since that point.
The brain is in recovery, and there are some things that they may not be able to do as well as they did just 2 weeks before, but things are going to get better.
We have access to so many different other specialties and therapy services so that we pretty much have everything covered that a patient would need.
We're putting a lot of minds together, which is always going to improve the outcomes that we have.
Neurologists, physiatrists, psychiatrists, psychologists, and therapists, all to improve the physical, emotional, and cognitive deficits. And the most remarkable thing about all of this is that we're here together at one time. Every week we have a traumatic brain injury patient care conference where every member of our team sits around the table. We all come to a consensus on how we're going to proceed forward in the care of that individualized patient.
We have some technology that not a lot of clinics have.
One of them is our Vertec machine. A patient goes in and they're on what's called a force plate, which can kind of measure their weight distribution during it.
It uses a three-dimensional virtual reality screen that does not require people wear goggles, where we can assess balance and vision at the same time. We have a gait lab that has 20 cameras. We have them walk into the gait lab with the markers on their body and strike the force plate so we understand their strength, their balance, and their symmetries or asymmetries. Then there are some of the virtual reality tools that we use to track eye movement.
People's ability to focus on something is taken away. They're just kind of like in the dark in these goggles, but then I can see how their eyes move.
We also have two main recovery tools. The first of which is float tank, a sensory deprivation experience. This helps the body recovery. This helps the mind quiet. And then there's the light therapy called photobiomodulation. It enhances healing of the skin, of the muscles, and of the body. We are really excited to have some of the most advanced technology. Our intention for the Neuroperformance Innovation Center is to have a national reputation with a community impact. It is incumbent upon us to make sure that every West Virginian has access to this high-level care.